Hey everyone, this is Tony Reeves and this is Reeves Point of View. I want to talk to you about COVID and mental health and the access to mental health providers. When I used to practice law, I used to have clients who were, quite frankly, quite a few of my clients didn't have a lot of money. And so when they needed to utilize mental health services, they were utilizing whatever the community mental health services were in their particular counties. And it was interesting, and just to kind of share a story with you, I lived and I worked in an area in Florida. It was called Poinciana, Florida. It was literally on the borderline of two counties. So there was Poinciana, Osceola County, and Poinciana, Polk County. Now, for those of you who are not familiar with the geographics of Florida, let me just tell you about Polk County. Polk County is, like, I believe land-wise, is like either the largest or one of the three largest counties in the state. So it was interesting to have clients there who sometimes the services that they need to get to, depending on where they were, may have been easier for them to go to a neighboring county because those services were closer, but they couldn't because it was outside of their jurisdiction. Imagine being in a situation where you're sitting here and you can literally see the place that can provide you the treatment right across the county line, but you can't go to it. Well, you can go, but you're not going to get any treatment because you're no longer in their jurisdiction. I just stress that to say this. In this time right now, we have seen quite a few lockdowns, quite a few people having to be shut in. And the reason why I say is we're seeing more and more discussions out there about mental health and mental health impacts as a result of the COVID-19 pandemic and how that's affected people. Not only on people who's receiving mental health, who have mental health conditions, but on those whose mental health conditions have started to manifest as a result of depression, anxiety, things of that nature. All of those things are devastating, but they're even more devastating if you are a person who is already struggling to get access to your mental health services because of your financial status. It's even magnified when you're being restricted from being able to access them. Now, I can tell you, I'm pretty sure the advent of telemedicine has gone a long way to trying to make those things a lot easier, but I cannot stress enough, please be understanding and sympathetic to the reality that there are people who need access to care, that access to this type of care was difficult even before the pandemic kicked in. So now, as we are starting to work our way through and come out of the pandemic, it is becoming, we are seeing more and more episodes, or greater episodes, where people realize the need for this type of treatment more so than anybody else. So keep that in mind when you're sitting here looking at a loved one or somebody that you know who's already struggling with mental health conditions and struggling to get access to it because of their finances. The situation we're in is making things so much tougher. Please be understanding if you can. Hey everyone, this is Tony Reeves. If you like my content or have any suggestions, please let me know, and by all means, make sure you share. The only way I can get my word out is you help me get the word out as well.